Okay, let's talk about something that so many of us deal with: hormonal acne. You know that feeling when you're doing everything right for your skin, but the breakouts just keep happening. It's incredibly frustrating. So in this explainer, we're going to get into the science of why this happens, and more importantly, we'll look at the treatments that are actually proven to work.
So, I have to ask, did you think acne was something you leave behind in high school, only to find it popping up again in your 20s, 30s, or even later? Yeah. If that's you, you are absolutely in the right place. It can feel so isolating, but I want you to know it is not just you.
And let's get one thing straight right away. Adult acne is a medical condition. It's a chronic inflammatory skin disorder. It has absolutely nothing to do with being unclean or something you're failing at. It's all about these really complex hormonal signals that are happening deep under your skin.
And get this, the clinical data shows that more than 80% of all adult acne cases are in women. Now that is not a coincidence. It points us directly to the huge role that our hormones play throughout our lives.
Okay, so let's get into the science of it all. Because if we really want to understand how to treat hormonal acne, we first have to understand what causes it. We're going to look at the specific hormones that are kind of flipping the on switch for breakouts.
So the main characters in this story are a group of hormones called androgens. You've probably heard of testosterone, that's one of them. And what we often think of them as male hormones, everybody has them. And in your skin, androgens have one major job. They send a signal to your oil glands telling them to start producing oil. And this just lays it out perfectly. It's a chain reaction. First, you get that androgen signal, that on switch we talked about. That leads to step 2. Your skin starts making too much oil, or sebum. Then, that extra oil mixes with dead skin cells and creates a plug inside the hair follicle. And finally, that clogged, oily environment is the perfect place for bacteria to grow, which triggers the inflammation, redness, and swelling that we see and feel as a pimple.
But, while androgens are the main driver, they're not acting alone. Genetics play a massive role. So if your parents had adult acne, you're probably more likely to. And then things like stress, which can release more androgens, or even high-sugar foods and certain medications, they can all add fuel to the fire. All right, now let's zoom in on 2 of the biggest hormonal triggers for adult women: polycystic ovary syndrome, or PCOS, and the huge hormonal shifts that happen during perimenopause and menopause. Now, what's so interesting here is how different the why is. With PCOS, the body is actually producing higher than normal levels of androgens. But with menopause, it's a different story. Your estrogen levels drop way down, but your androgen levels only drop a little. This creates what we call a relative excess of androgens. So even though the levels aren't technically high, they're